Hello all, I'm Dr. Rutuja Patil from KM Hospital Research Center in Pune in India. And through the next few slides, I'll speak about the bridge guidelines which were developed to ensure that global health research is conducted with fairness and integrity. So research integrity and fairness have gained considerable momentum in the past decade and have direct implications for global health epidemiology and thus global health policies. So, research integrity has emerged as a response to the reproducibility crisis, which means that the inability to reproduce research findings and also to curb research waste, which has shaken the foundations of most scientific disciplines. Epidemiological research findings are affected by design, implementation, analysis, and reporting methods. If all the above steps are performed inappropriately, it will definitely result in reproducibility crisis. There are various guidelines and codes of conduct which aims to improve and guarantee research integrity in epidemiology and more generally in science. You could see some examples in the slide here. Research fairness, on the other hand, refers to the power dynamics in global health research impacting both local researchers and local communities. The goal of research fairness are broadly aligned with the efforts to decolonize global health, topic which was reignited recently with the Black Lives Matter movement. Here too, there are a number of established codes of conduct to ensure fair and equitable research, then impact where it matters the most in the communities and in the research systems where the research is conducted. So, research integrity and fairness together could equally nurture to produce high quality, impactful research, but bridging the two can lead to practical and ethical dilemmas. So, in order to provide some practical guidelines to the researchers and epidemiologists, we set out to develop good epidemiological practices specifically for global health epidemiology, targeted at the stakeholders involved in commissioning, conduct, appraisal, and publication of global health research. So, before I talk more about, I would emphasize that the bridge guidelines which I'm speaking are broadly aligned with the objectives of decolonizing global health, which I would like to rephrase as globalizing global health. Research integrity and fairness practices, when implemented in global health research, can help us produce high quality, impactful research. Yet, bridging the two can lead to practical and ethical dilemmas. Hence, bridge guidelines are an effort to provide practical guidance to researchers and epidemiologists globally. Global health research has the ultimate impact on the local populations, and hence shaping or designing scientific research should ideally be driven by the context. However, as we all know, institutions that have enough resources are at advantage of shaping research agendas. And we are also aware that of the fact that all such institutions mostly are based in the country which are located in global north. So the bridge guidelines which develop a checklist to conduct epidemiological research are published in 2020 in BMJ Global Health. And these are accompanied by another article which explains and elaborates these guidelines. Both these publications are open access, which all publications should be. So these guidelines were a two-stage process. The group first developed preliminary guidelines by reviewing existing literature, identifying elements of research integrity and fairness, synthesizing basic guidelines, and validating those. And these preliminary guidelines were then validated by 163 people over email, followed by a couple of rounds to interact with nearly 45 participants, and in the end, a face to face meeting with 8 uniquely chosen participants based on their professional and geographical background, as well as their inputs in the previous round. So this Delphi exercise was commissioned. It started in 2018, and Dr. Sandra Alba, who is the moderator for today's session, led this team which was working on developing the bridge guidelines. So we developed this guideline following the participatory Delphi consultation process involving many stakeholders of global health epidemiology, representing various discipline, institution, countries, which were across the globe. And finally, the bridge guidelines consisted of 6 standards and 42 criteria covering all stages of research of epidemiological studies. So these stages include study preparation, protocol development, data collection, data management, data analysis, dissemination, and communication. The bridge guidelines function as a checklist with practical user-friendly tips for global health epidemiologists embarking on new studies. Using the guidelines help ensure that studies are conducted according to the principles of fairness, of integrity, and thus it helps navigate practical and ethical dilemmas along the way. Although the details of standards and criteria could be found in the published papers and also on our website, I would like to mention some scenarios which could help you understand the use of bridge guidelines. The first and the most common scenario is where there's the issues with the data quality, leading to discarding partial or complete data set because it is not usable. In the second scenario, it's pertaining to the choice of methods, like, for example, using quantitative, qualitative methods and being able to sometimes the choice of methods cannot fulfill the study objectives in a way they expected to. And hence, there's a lot of research data wastage here in this scenario. And many of you may be familiar with this third scenario, which I am talking through. The invited stakeholders may not be interested in your research and attend your dissemination meetings only because they were invited and not because they were interested. So, in such scenarios, how could bridge guidelines help us work towards more integrity and fairness practices? There may be more scenarios, but this will help you understand that every research stage must consider and consult the end user of the particular stage before planning it. Coming back to the scenarios, in the first scenario, the the person who would analyze the data or the statistician could have been consulted before the data collection was planned. They could have informed about the expected quality and probable issues which one would have overcome in the data structure. In the second scenario, when conducting multidisciplinary research, it is important to have clear ideas at the outset of the study about how the different disciplines fit together and how they can, one, address different aspects of knowledge gap. Secondly, complement each other to provide a complete understanding of the issue at hand. And once this is clear, strategies need to be developed to integrate these methods. One simple strategy is to organize regular meetings between different study team members at key moments in the conduct of the study to share material and invite feedback and create links and dependencies. Third scenario is important at all research stages. One of the reason many global health studies do not translate into action is because the key stakeholders are not engaged early enough in the study in planning or in identifying the research question. As a result, they may not answer the most relevant questions for the decision makers. They would easily say that this was not needed and this is not the way we wanted the answers for. So often in global health, studies are conducted by external parties who may not know the settings very well, what has already been done, what hasn't been done, what has failed earlier, and what has succeeded, or why not certain things happen. So each country will have its own systems in place and very specific knowledge gaps. So this needs to be taken into account earlier on the studies to ensure that the study provides useful and relevant results. This is why in global health, one of the very first step is to conduct study is to engage stakeholders. This includes both end users as well as affected communities of the research. So to summarize, these guidelines are available along with the checklist in on the website bridgestatement.org. The checklists are in English, French, Spanish, and Swahili. We have created some booklets and videos which also could be accessed online. Further, we are currently conducting a survey to understand the magnitude and determinants of research integrity and fairness across global north and global south. The survey aims to address both issues by fostering better standards for global health epidemiology with a dual focus on research integrity as well as research fairness. This multi country mixed method survey will ultimately assess the extent to which research integrity and fairness are achieved in global health research. We have also initiated some coaching programs which will help the researchers to use bridge guidelines effectively. Some students are currently using these guidelines for the PhD and master thesis project. So summarizing that you could see some sunshine across beyond the bridge. So look forward for people using bridge guidelines. Thank you.